Hi, my name is Prematta, and this presentation will talk about mood disorders and the impact occupation plays on major depressive disorders specifically. So in order to understand how occupation impacts MDD, I think it's important to understand some facts about it. So the age of onset is between the mid-20s to late 20s, and some co-occurring conditions that go alongside with MDD include anxiety, personality disorders, and substance use disorder. Some additional facts about MDD. So people with this disorder have a higher risk of suicide, and they present with depressive symptoms such as hopelessness, emptiness, anhedonia, which is the loss of interest of things that they used to find enjoyment in. They might have weight or sleep changes, poor self-esteem, and impaired cognition. And in order to meet the criteria for diagnosis of MDD, they need to have at least 5 of the 14 total symptoms, and 2 of those symptoms need to include the depressed mood or loss of interest or pleasure. OT interventions in mental health focus on skill development to manage symptoms of the disorder and promote increased participation into the day-to-day activities and routines. Engagement in occupations such as leisure activities, social participation, and school and work promote improved self-confidence and self-concept. Additionally, participation in meaningful activities supports improved emotional regulation and overall health and well-being. Occupational imbalance is described as the imbalance of time spent doing what is needed to do compared with what an individual wants to do. For example, occupational imbalance may occur when an individual spends too much time working instead of engaging in their preferred hobbies or family time. Similarly, occupational imbalance can occur when an individual prioritizes an occupation such as rest and sleep and disregards all other important occupations such as work, education, or ADLs and IDLs. As OTs, it's really important to engage clients in their regular occupations. So one of the reasons we do this is because we want to establish routines that promote increased engagement in self-care activities such as bathing, dressing, and hygiene. Also, engagement in health maintenance occupations such as medication management and healthy lifestyle choices promote overall health and well-being. Some examples of this are eating healthy, exercising, and taking their medication on time as scheduled, including the right amount of medication. All of these things can help prevent their condition from worsening or prevent other conditions from developing. Additionally, engagement in employment, school, or social and leisure activities promote a sense of purpose and structure to one's day. This can help reduce feelings of worthlessness and guilt, as well as reduce MDD symptoms such as body aches, fatigue, suicidal ideation, and eating and sleep disturbances. Engaging in ADL and IADL activities ensure that an individual is taking care of themselves and their loved ones physically, mentally, and emotionally. Some examples of these forms of self-care include eating healthy, exercising, and going out to social activities such as hanging out with friends or celebrating a holiday with family. Living a sedentary lifestyle with reduced occupational engagement increases the risk of developing a variety of mental and physical health issues such as obesity, depression, substance abuse disorders, cardiovascular disease, chronic fatigue, and musculoskeletal conditions. It's really important that OT interventions in mental health focus on skill development to manage symptoms of the disorder and promote increased participation in roles and day-to-day routines. Engagement in occupations such as leisure activities, social participation, and school and work promote improved self-confidence and self-concept. Additionally, participation in meaningful occupations supports improved emotional regulation and overall health and well-being. When working with a client with any type of mental health condition or mood disorder, the client's family should be included in the care plan. Some examples of family considerations include providing community resources and psychoeducation. Psychoeducation might include educating the family on the disorder's signs, symptoms, medication, and treatment. The OT can also model how to provide support to the client and validate the client's experiences and feelings. It is important to reduce the risk of transference by ensuring the family is engaging in self-care activities to maintain their health and well-being. Transference occurs when a client's negative mood impacts the people around them, resulting in a loved one potentially experiencing similar symptoms as the individual with the disorder. Lastly, because individuals with MDD may struggle with suicidal ideation, it is important to remove or lock medications and sharps to maintain client safety.